We don't want a situation which I suspect is developing, a situation in South Africa or anywhere in the world, but let me talk of South Africa, a situation where people get used to the fact that there is TB, there's HIV and AIDS, and yes, they are there. Yes, no, I get used to the fact that they are there and we're going to live with them forever and ever and ever and ever, amen. We should not allow that situation to happen, because if it happens, we are in big, big, big trouble. We should not also allow a situation where people who are on ARVs or anti-TB treatment opt out. Because if they do, they develop drug resistance. Massive drug resistance that make the disease, the treatment very expensive. We shouldn't allow that situation. That's why, even with the PEPFAR pull out, we still went to Chris Hani Baragwanath Hospital 3 weeks after PEPFAR pulled out and launched the 1.1 million campaign. We still did so. Because if we don't, we will just need more and more and more money to deal with these diseases. And it will force us into dependence, as we're turning to be. So, ladies and gentlemen, we are really asking you, let us move together to run these two campaigns together. So, look, at the moment for HIV and AIDS, the 5.5 million people are on ARVs. We are spending 46.8 billion rand just for that. Just for that. And if we keep on adding more people, obviously that amount of money will increase. For TB, I don't know, Prof. Njeka, I was told that it went dramatically down. But a few years ago, when I was in health for the first time, and I think it's about 6 years ago or so, people with extreme drug-resistant TB, in order to cure them, we needed 800,000 rand per person. That's why the private sector was not interested. It was not interested because a lot of money. And only the government carried the burden that this person has got extreme drug-resistant TB. 800,000 rand is needed to cure that particular person. So imagine what can be achieved with this huge amount of money if we were to bring HIV, AIDS, and TB under control.